Now, add stress to the obsessional professional. You see, what an obsessional does when they experience stress is they turn it into something different. They turn it into pressure. And then what do they do with the pressure? They work harder. Now, that's fine if we're at university, school, and the exams are going to be over in 2 or 3 weeks. But what if it's life? And your solution to being under pressure is to work harder. Because the obsessional is trained, has perfected the art of not feeling stress. They notice it, sure. I say, I'm a bit stressed. But it starts to evolve, it starts to eat away at them. It comes out emotionally, burnout, depression, or it comes out physically. They start seeing their GP for their gastric reflux. They're found to have high blood pressure, having frequent recurrent viral illnesses. The relationship between stress and physical illness is no longer a debate. It's only a matter of degree. So the obsessional becomes very good at ignoring, not taking any notice, and yes, working harder. You might have heard the metaphor, the story of what happens if you boil a frog. Now, humour me, this is my only vaguely veterinarian metaphor. But the story goes, if you take a frog and you put it into a pot of boiling water, it just jumps out again. But if you take our little friendly ectotherm, my other new veterinary word, and you put our little green Kermit into a pot of nice warm water, and you just slowly heat it until the water boils, then apparently our little froggy stays there until, well, frog legs are served. So the point being that you've got to get out of the pot. And the obsessional is really good at hanging in there. They're really good at hanging in there. To the obsessional, the solution, if they were there with the frog, it'd be swim harder, go on. But it's not going to solve the problem. You've got to get the frog out. Which brings us to, I haven't got time to cover all of the issues that we need to think about in this space, but there's a couple I want to cover. And that is the need for anybody when they're under stress. They have to take time out of the stress. They have to get out of the pot and they have to go and do something else that is not anything to do with that stressful environment. And preferably they want to do it with their friends, family, they want it to be relaxing, they want to have fun. Something that doesn't come easily to your typical obsessional professional. One of the things I do when I'm working with obsessionals, and I did this with Oliver, you can actually harness the obsessional personality in the right direction because they're very driven, and what you've got to do is try and grab that and use it to help them change in therapy. And Oliver did exactly that. So yes, you've got to find other things to do. You know, find a hobby, a pursuit. You know, obsessionals aren't very good at doing nothing. So when you say go home and relax, they don't know what you're talking about. They look at you as though you're speaking a different language. But if you teach them to go fishing or remind them to go fishing, you have to teach them. Or some other pursuit, whatever it is. But you've got to go and do something else. And for the obsessionals amongst you, the best argument I can give you for why you need to go and do something else instead of work harder is because of some really interesting research that I've done that I haven't got time to talk about tonight, which is about how the human mind best solves the most complex problems it's dealing with when it's not dealing with the complex problems that are troubling you. Who's had the experience here of trying to solve a complex problem, working away hard at it, and then going off and doing something completely different, or maybe just going to sleep and then waking up in the morning or while you're doing something else going, that's what I've got to do with that problem. Show of hands, who's had that experience of solving a problem when you're not trying to solve the problem? Right. It's incredibly common. And the thing I'm really interested in is how do we actually perfect that? Because there's something really, really cool about doing that. But for the obsessionals amongst you, I want you to remember that you will solve not the easy or the less complex problems when you're not trying to work on the problem, but the most complex problems when you're not trying to work on the problem. So the obsessional needs to be what I call militantly quarantining time to do things other than the thing that is causing the stress. You have to get out of the pot. There's one other thing that Oliver's story takes us to, and that is that the nature of the obsessional is to distance. See, that pursuit of order and excellence that I mentioned? The pursuit of order and excellence takes you away from other human beings. Why? Because other human beings have an annoying habit of not doing what you want them to do when you want them to do it. And when you're stressed and you need to get stuff done, it's actually easier to pull away from other people and not have them in your face, annoying you, slowing you down. And this is when they say to me, yeah, I haven't seen much of my friends. I've been pulling away from my family. They don't understand what I'm going through. And now something very profound has happened. This is the beginning of the downward spiral, because they've started to pull away from the only people who can help them. See, Oliver gave a very clear description of something that was the most profound clinical finding from my research, and that is how the human mind, when it gets very, very stressed and turns to suicide, it collapses down its perception. It is unable to think of all of the different options that are available to it that mind can think of when it is well. It's called collapsing of perception. It's a tunnel vision. And it seems incredibly logical to go to the next step, which is to kill yourself. It seems to be like a very clever solution, a brave solution at one level. But it begins with that separation, with that isolation. Understanding that concept of perception narrowing means that if I can give you one take-home message, just remember the worst time to commit suicide is when you're suicidal. Wait till you're better, till you're well enough to be able to think clearly and get help. I had a patient call me once. It was late at night. No patient ever calls you when they're suicidal in your lunch break, when you've got time to help them and organise care and appointments and stuff. No, they always call you, but that's okay. And he was clearly very suicidal, and I got him through that. And I saw him a couple of days later, and I said to him, because he thanked me, he thanked me for saving his life, and I said, well, what did I do? Because I was kind of interested in which of the clever things I'd said or done had made the difference, had brought him back from the brink. And he sat and he thought about it, and he scratched his chin and he said, you answered the phone. That was when I learned something that I'd been taught but I hadn't believed. The power of just being with somebody. See, I thought I had to do something clever. Even as a psychiatrist, I'd been out 10 years at that stage. But no, what made the difference for him was that, well, I did more than answer the phone, of course, but it wasn't anything I said that was particularly clever. It was just that I listened, and here's the important word, I connected with him. Remember, we've got this isolation that is pulling them away from us. And what we need to do is to push back in the other direction, gently, by connecting. In short, it's not about the clever words. It's not about the solution. It's about the connection. A couple of quick tips. Never say to somebody who's distressed, I understand. Never, ever say that. Even if you've had a similar experience, it won't be the same as theirs. It sounds very ingenuous. Most people will react to that with, how could you possibly understand? No, just do the opposite. Say to them, I can't understand what this must be like for you, but I'd like to try. Another tip, how to raise this issue. People worry about talking to people about being suicidal. Here's a phrase that you can try. People going through your kinds of experiences often have thoughts of suicide. Are you? Don't worry, you cannot put the idea into their head. I don't think I've seen a person who has been seriously suicidal, particularly a professional, who hasn't thought about it. They might dismiss it after they've thought about it, but they've thought about it. And they often want to connect and talk about it. Now, I want to conclude by coming back to a point that I made earlier about how we psychiatrists have a bad habit of killing ourselves, and that we do that because we think, well, what more help is there? I'm the expert. You see, psychiatrists get tunnel vision too. We're not immune, same process. But we ask the wrong question, which is what our tunnel vision takes us to. The question we shouldn't be asking is, what could that person know that I don't? The question is, who? It's about connecting with another person again, of course. You see, you don't need somebody who knows more than you do. You just need somebody who doesn't have your mind if you're suicidal. You just need a different mind. Another mind that can organise help. Now, of course, we do need the person who's suicidal to allow you to organise that help. And perhaps some of the most difficult work that I do is amongst relatives who tried to help somebody who then killed themselves. We can't blame ourselves if we've tried and they didn't let us. But at these times, that's typically when, in psychiatry, we need to hospitalise somebody. We don't lock them up and give them shock treatment. We just lock them up until they get better. Because one of the other things about that narrowing of perception is it leaves people thinking that this will never change. Now, there are very few guarantees I can give in psychiatry, but this is one of them. This too shall pass. Everything passes, everything moves on, every emotion comes to an end. Even if you have clinical major depression, we know from the research, if we don't treat it, you'll get better in 12 to 18 months. If we treat it, we can do a lot better than that. Bipolar disorder. People get manic and they get depressed. If we do nothing, they will come out of the phase. This too shall pass. It's one of the only things that I can guarantee. So, what a person needs the most is just another person. Friend, family member, maybe a therapist. And this is what I think of as the power of one other. So, 3 messages. Try never to forget that the worst time to commit suicide is when you're suicidal. Militantly quarantine time, just as you would militantly work. Militantly quarantine time to do something outside of the stressful situation. Preferably do it with friends, family, loved ones. Sometimes you need to go and recharge and do something on your own. Ride a horse for 2 days and spend some time out with Mother Nature. And finally, I want you to remember, it's not about the solution, it's about the connection. Never forget the power of the other one. Thank you.